Hello, everyone, and welcome to Mind Your Mental, a podcast that seeks to educate, empower, and uplift those seeking guidance through the monumental world of mental health. I'm your host, Raquel Martin, a PhD candidate in medical and clinical psychology. This podcast is not meant to be a substitute for a relationship with a licensed mental health clinician. Thank you so much for tuning into the show, and I hope you enjoy it. Okay, everyone, welcome to Mind Your Mental. Today, we are joined by another amazing guest, Dr. Erlanger Turner, who is a clinical psychologist. And y'all, I got another unicorn. And I know if y'all are listening, you understand that like Black male psychologists are unicorns. And I found another one. I'm over here like looking everywhere. So Dr. Turner is an assistant professor of psychology at the University of Houston downtown. He often contributes to news articles, really good ones too. And they're not even, so I feel like a lot of times news articles from professionals and doctors with degrees are too technical and you can't understand them, but they are very well understood by everyone. So just the FYI, you can read these articles as well. He also maintains a blog as a media psychologist, and he earned his PhD in clinical psychology from Texas A&M University and completed his postdoctoral fellowship through the Johns Hopkins University School of Medicine. So his research interests include ethnic minority mental health, race relations, health equity, access to behavioral health services for youth, and cultural competency in clinical practice, which is something we talk about all the time. He has published numerous articles in peer-reviewed journals and has served on journal editorial boards. And he was also the 2017 chair for the Board of Advancement of Psychology in the Public Interest for the APA. He's also a member of ABPSI, which is Association of Black Psychologists, if you don't know, and the APA. That's a lot. It's a lot. How are you doing, Dr. Turner?
I'm great. Thank you for having me on the show.
So I know I read so much stuff. Thank you for being here. But like, how would you like to introduce yourself?
You can call me Dr. Earl or Earl is fine.
Okay. So Earl, tell us a little about yourself.
Yeah. So as you mentioned, I am a psychologist, and I'm currently in Houston, Texas, primarily teaching undergraduate psychology courses right now. But I also spend a bulk of my time involved in training of professionals, including psychologists, other therapists at different levels of training. And then, as you mentioned, I spend a lot of my time with media work, and part of that is really my mission focused on addressing mental health awareness. And one of the reasons why I really try and focus to make sure that the content that I write is understandable by everyone, so that it is basically taking psychology to the public so that they can get that information.
Yeah, and that's really important to me too, because I feel like everyone will not come in for a session. Like I think a lot of people need motivators to come in for a session, and I think they also need different avenues, right? Because everyone isn't going to want to read an article, so they may watch the video. Everybody might not want to catch the news, so they may be able to listen to the podcast. Like I like the fact that you're so available in so many different dynamics, because it really does open it up for more people to learn about psychology from an educated professional, and they can look at it in whatever avenue they want.
Yeah, and I think as I'm getting more into doing some of the social media stuff, I'm learning that people are, I think, more interested in audio and video stuff, which is a little bit out of my comfort zone. So I've been trying to push myself this year to do more of that. But I do think it's important to have sort of multiple avenues that people can get that information.
Yes. Also, yeah, because I mean, I think a lot of people like the social media aspect because it's just bite-sized information, right? Like, and and people like to just watch people and see somebody and feel like you can connect with them. And I think you get that more in the media than you do from like reading an article sometimes. So I can totally get why people like that aspect of psychology. So one of the main reasons why I wanted you on the show, besides your expertise, is because you seem to have a lot of the same interests that I have when it comes to mental health and minority health disparities and cultural competence. And I haven't been able to talk as much as I would like to about the expertise that it takes to work with young Black males or males as a whole when it comes to psychology. And I know that's one of the things that you work with as well, like you focus on youth and psychology.
Right, yeah. And so for me, I was trained, as you mentioned, as primarily a child psychologist. So most of my specialization was working with kids, but I've sort of gotten more involved in working with boys and men in general over the last couple of years, because there is a need, and I find that men specifically might be a little bit more comfortable if they can sort of talk with other men about some of those mental health challenges.
Yeah, I can get that. So how's your experience expanded? Like what has been are you working primarily with individuals? Are you working primarily with groups when it comes to Black men? Like what's been your experience working with the Black male population?
Yeah, so most of my experience has been probably doing more group work. So I've done a lot of work within the juvenile justice system, working with adolescents, so juvenile boys that may have been um, out of school because of some issues related to aggressive behaviors or delinquency, or even substance use. And so I've done some of that work. And then just in terms of my work with men in general, a lot of it has been more individual, or I've also had experience working with couples and couples therapy. And so I think that's also another sort of unique area for men to be involved in psychology as a couples therapist, because oftentimes, again, it tends to lean towards more women in the profession. And so if there's a male sort of helping couples navigate those challenges, sometimes it's a little bit easier for men to sort of get involved in terms of that process.
Yeah, so it's like a representation matters, and it's specifically, it definitely matters in psychology too, right? Like, where do you see with your experience with working with like Black men and Black youth and males, like couples and individual and group, like, where do you see, what would you say is, I don't even know how to frame it. Where's the need? Like, what services do you feel like, or what disorder do you see popping up more that you feel like there needs to be a greater need for like education or getting therapy services for it? Because I've noticed lately with the population I'm working with, I see a lot of Black males in with depression. It's coming off as anger, but it's more so depression.
Right.
So that's where like I feel like there's like a red flag, there's a need, but I wonder if it's the same for when they're adults or like in couples therapy, specifically with Black men.
Yeah, I mean, I think you touched on a good point, because I think a lot of the research does talk about when we look at men, the way that they exhibit certain disorders is much different than how we might typically see it in the general population or even among women. And so you touched on depression specifically, and oftentimes in men, it does tend to come off as more being sort of irritable aggressiveness, as opposed to this sort of typical sort of withdrawn sort of nature that we might see in sort of a classic depression. And so I think that's probably one of the more common things in sort of acting out behaviors as a way to sort of cope with things like anxiety or even depression. And I think for me, I contribute part of that to just sort of dealing with traditional masculine norms that boys are taught up in terms of how we cope with things within the environment. And so it's okay for us to be angry and aggressive, but it's not okay for us to be sort of sad and sort of moping around. And so I think oftentimes the way that men and boys sort of express their feelings is through anger.
Yeah, I could definitely see that. And you talk about the traditional masculine norms. How would you define that for individuals who may not know as much about it? Like you did a great example when it comes to talking about like difficulties expressing emotions and stuff like that. Where are some other scenarios where you may see the traditional masculine norms popping up and they may be causing difficulties?
Well, I think like in terms of dealing with so restriction of emotion, so not being able to talk about your feelings or wanting to talk about your feelings, or it's not manly to talk about your feelings. And again, sort of prefacing that with not every man is going to sort of adhere to those strict, you know, masculine norms of manhood. But that emotional restriction is one. Sort of the tough guy image, over reliance on sort of self as being another characteristic, and of course the one that probably is often sort of um, talked about in the media a lot, related to like over sexualization, and sort of this being the player type guy is often another characteristic that sometimes can lead to some challenges for some men, particularly when it comes to relationships.
Yeah, and you know what else I have found, and I don't know really know how I feel about it, but I have seen the word and the term toxic masculinity like thrown around so much. So I have a problem with words sometimes when they get used too much
Mhm.
because I think they just lose their meaning after a certain and I don't know, the toxic masculinity thing. how do I describe it? So okay, so it reminds me of like the cry wolf thing. Like I think sometimes it gets thrown around in topics that are not appropriate, and then when it as is actually appropriate, it doesn't really get identified that way because so many people have been throwing it around so much that they're like, okay, so I guess I opened my soda the wrong way. That's toxic masculinity. You know, like if that makes sense. Like it just seems like it's been used so many times, and to me, it's been
Right.
used incorrectly sometimes. That when it's the actual time to address it, it's just like. Y'all used it too much. Now nobody wants to hear it. Now everybody
Right.
thinks we're attacking men, we're attacking black men, you know, like everything's toxic masculinity. And I think it's because it's just I don't know. I don't think it was defined well in the beginning, and people just put it on everything.
Right. And so, and I talked about this on my podcast, a couple months back, and I wrote a blog on it on Psychology Today, as well. And I agree that people sort of use toxic masculinity and traditional masculinity interchangeably. And so I think being able to understand like differences of when does masculinity turn to be harmful, sort of that problematic area is not the same thing as sort of traditional masculine norms where if someone is overly self-reliant, that's not toxic because you want to rely on yourself. I mean, it could lead to some difficulties, particularly if you are, let's say, dealing with a mental health issue and you don't want to get help because you feel like you need to deal with it on your own. Then it's sort of crossed over into that toxic area. But just sort of having a degree of wanting to be, self-reliant doesn't necessarily mean that that's toxic.
Yes, good. See, great. Do you have more examples? Can you share more examples? Because I agree. I think sometimes like I will see someone mention like a behavior that someone exhibits, and they're like, "Oh, that's the result of toxic masculinity," and I'm like, or maybe he's just a jerk. Like maybe just him being a man and him being a jerk. They don't have to be interchangeable. That doesn't have anything to do with toxic masculinity. That's just him as a person who just
Right.
like is exhibiting bad stuff. Like so. Do you have more examples? Like about how it can be perceived incorrectly, because this is like one of my pet peeves lately. I see it everywhere, and it's like,
Yeah,
oh
I mean, I
god.
think sort of thinking about it offhand, it's a little bit hard to, now that you put me on the spot to think
No
to think
pressure.
about the examples, but I think so that would be one. I think sort of the emotional restriction piece, like not wanting to talk about your feelings is not necessarily problematic, right? I mean, I think we all
Hmm.
sometimes get in situations where like we've just had enough and maybe talking about it is not going to help the situation. And so why keep sort of, talking about the same, beating a dead horse, so they say. And so I think like in a situation for men, like for most of us at least, we have grown up in households where we've been told that it's not okay to sort of be sad or cry. So if a boy scrapes his knee, you tell him to toughen up, right? But if a girl does that, you want to cuddle her and say, "Oh, it's okay," let her sort of get her emotions out. And so I think that sort of leads into a situation for a lot of men as they grow older. Then they've been taught that to be a man involves me not expressing my emotions. Is that wrong? Maybe, maybe not. But I think what one of the challenges is for us as a society to let boys know that it's okay to sort of express the range of their emotions. And I think we're getting to a place where people are being more open about discussions about what it means to be, what's involved in manhood, for example.
Yeah, I think so too, because like you mentioned, the trajectory, right? When it comes down to, you get taught this as a boy, so then when you get older and you're a man, like it can be more difficult. Yeah, and I see it a lot. And not I don't do relationship therapy, so I can't say I see it in relationship therapy. I just really see it when I'm talking to my girls about like this fool done, like like just typical like that kind of stuff where it's just like, oh well, he won't talk about his feelings. Well, how do you know he's been taught to do that? Like what like let's pump the brakes a
Right.
little
And
bit.
so and
Like,
I touched on this on my podcast too. And so I think that's a great example. So one of the challenges I think is that when we socialize boys to not talk about their feelings and emotions, then when they do get older and they're in relationships and the person that they're dating has issues with that, then it's like, okay, what do you expect? But on the flip side of that is that if he begins to maybe express too much of his emotions and feelings, and then there's another sort of I don't know if I want to say label, but there's a different sort of perception that may come along with them with women who perceive men to be too emotional. And so I think it's sort of a fine line about, okay, what's enough, right?
Yeah, but I think you're right. I think it is a label though. Like, I'm sure you don't want to say a specific label, but it is like you. So it's either, I mean, like, when is it enough? So like, I can either not talk about my emotions, and then I'm toxic, and then I can talk about them too much, and then I don't know. They may label the person as soft. Like, when do you know?
Right.
There's no, like, that's a difficult position to be in, right? Like, it's like when it comes to being Black in America and engaging with the world, like whether you're male or female, you have to, there the different situations you can put and be different, and it's difficult. Like for women, you can either talk out too much and then you're loud and you're sassy, or you can not talk enough and then you can't stand up for yourself, and then it's like, okay, well, what would you like me to do? Like, which box do you want to put me in today?
Mm-hmm.
That's
Right.
honestly what it is. I think a lot of times, and that's why people, they like labels, because people don't know how to engage with people until they put them in that specific box. Instead of seeing them as a person, you feel the need to see them as a label. So instead of, and you got to know, like, whoa, where are you from? What are you mixed? What's your race? What do you do? And these are all like labels. Why can't you just engage with someone as a person?
Right.
And it's more difficult. So I think that's why there are labels when you can't fit someone in a specific box, because it's hard for you to engage and it takes more work, and you have to
Yeah.
actually try to get to know someone as a human
Yeah.
being.
And I think that's a whole nother podcast because I think as society, that's the way that we're taught. Like as Americans, we like to put people in boxes because it helps us get a sense of like who this person is and what we should expect from this person.
It's also how we learn too, right? Like
Yeah.
it's how we're taught, just like you said, it's how we learn. And it's like, it's typical school stuff. It's how you categorize things to learn pretty much every subject, right? Like I can't think of anyone that didn't have some kind of like categorizing thing in there. I can't remember the psychologist who worked on this. It was an old white guy. I can't remember. But because there's so many. But he specifically talked about this and how it's quicker to learn that way when you do categorize.
Right. Because of the schemas that you develop.
Yes, yeah, because of that. Like it's easy. That's why, and that's why I say, like, when you do that, it's the easy way, right? Instead of taking the time to integrate with someone in a better way, it's just quicker. And as a people who often have like so many different things to do, we want to do stuff the quicker way. So I need to know your label so I can figure out like, oh, when's the last time I engaged with like someone who's like you, and you probably have the same thing, so I'm going to engage with you the same way.
Right.
Instead of seeing them individually. Yeah, so I think that's like a really good point. I would say I've noticed that there's been an increase in youth, like Black males coming to therapy. Have you noticed any difference at all when it comes to, I think there's been a difference in the amount of education when it comes to mental health and it being okay, and like hopefully a decrease in stigma. I've noticed it in my practice. Have you noticed it in yours at all?
Yeah. So I mean, because I'm not practicing right now, I can't speak directly to that, but I will say that I've gotten a lot of requests for to see Black men or boys over the last couple of years. And I think, again, as I stated earlier, part of it is that there is a perception that there is not a lot of men, and part of that is true. And so when I think you come across Black men that are practicing and doing therapy, is that there tends to be a huge interest because it's something that particularly a lot of parents, I find, prefer to have a male therapist for their son. And so I think that sort of increases the desire for therapy because they know, well, there's a possibility that I can find a male to work with my son. And so that might sort of increase interest. And I think, as you touched earlier with like podcasts and social media presence, and I've come across a lot of Black male therapists on social media in the last couple of years, and so I imagine that others within the public have also seen that, and so that may have increased the interest in going to therapy.
Yeah, and I also think people like to see who they know. So like when they see the fact that, like, I've seen you on the news a couple times, and when they see the fact that like that they see you talk about a specific topic on TV or your podcast or your articles, they're like, okay, I want that guy, because like I already know that he would be able to work with me.
Yeah,
And even
that's
in
true.
my practice, honestly, like I've had multiple parents like, oh no, I wanted a male. And I'm like, I am so sorry. I find myself apologizing. I am so sorry. I'm not a man. We don't have any. Like so they're kind of forced to work with me. And it's kind of just like, I mean, I guess we'll
Yeah.
deal with you, but we really would have preferred a man. And it sucks to just be like, girl, I wish we had more too.
Yeah, and I think I had a conversation probably like 3, 4 weeks ago on my podcast about that. And I think the other issue that the public needs to sort of think more about when it comes to sort of matching based upon gender is also, does that male therapist have specialization in addressing the need that you're actually looking for? So if this person doesn't work with someone that deals with anxiety or depression, that may not be the best match for you, as opposed to someone who has that skills and expertise who may be female. But I think the public oftentimes doesn't think about that.
Yeah, I think the same way when it comes to specifically wanting a black clinician or wanting a clinician who's the same race as you. And I feel like the cultural competence aspect or the cultural humility aspect of it. I just got told in a training last week that it's not competence, it's humility now. So,
They're
so
trying to move away from that language.
that's what I got told last week. So the cultural humility that a person possesses is actually more important than the color of their skin and things like that. Because just because I look like you doesn't mean that I can totally understand you. But my training is supposed to put that in me, right? Like we go to school forever. We get training forever to make sure that we are able to work with so many different people. And I think that's something that might be a misconception when it comes to looking for a clinician, right? You just make assumptions that they'll understand where you're coming from. Like it's like meeting a new person or meeting a new friend. Like when you have friends, you want people who have similar interests in you. But
Mhm.
the training aspect is what's most important. It's really more important to check someone's credentials to make sure that they, you know, have stated that they work with your population. The best thing about psychology today, or therapy for black girls or therapy for black men, when you click the profile, it shows specifically what the clinician has expertise in. It shows who they're used to working with. Like that's the biggest thing because they
Mhm.
have training working with that individual. It can, I can walk right out of school and be a black female clinician. That doesn't mean I have as much experience with depression as someone who's who's still in training or something like that. Like you kind of have to look in terms of what you're struggling with and what you want to work with.
Yeah.
It's more so about the competence piece because everyone doesn't have it. Some people don't decide to specialize in that.
Yeah, that's a good point. And I think, one of the things that I often have been talking about as I do more work related to cultural humility is that if you look at the research, if you look at the research, that there's a portion of African Americans specifically that don't want a clinician that looks like them. And so I think there's like this, I don't know, there's a perception from some people related to competency that sort of goes with your ethnic background. And for some people, they feel like African American clinicians are not as competent. And so, because of their own bias and internalized racism, then that also sort of shapes their preferences, for providers as well. And so, I think that's the other side of that that I've often talked about when we look at sort of matching clinicians, is that in a lot of um, organizations, they may have few clinicians of color, and so they may sort of match all of their clients with that one person, but that may not be the person's preference. And so I think we need to sort of, again, get back to, as you mentioned, this idea of cultural humility and sort of understanding the client more specifically and sort of what preferences do they have related to the person that they want to work with.
Yeah, and that bias part of thinking that we are not as qualified, like someone that looks like you isn't as qualified, like that's some deep stuff though. Right? Like the fact that you specifically may not want a black person because you feel as though they may not be as qualified, like that's some intense like systemic stuff that's been put into that individual in the first place, right? Because I think it's not just that. I think a lot of people, it's not just psychologists, and maybe doctors, and maybe surgeons, and I mean that goes to the amount of it's just systemic racism that's been put in us as a people to think that like the quality that we have isn't as good, right? It's kind of like how I had a patient who recently got told he was acting white because he was getting really good grades in school, and I was like, are we still doing this? Is this still a thing? Like, is this still something that you say to people? So like white is automatically equated with intelligence. And I just
Right.
felt so annoyed because I was like, oh, I got that one all the time, but that was like years
Right. I was
ago.
just about to say, don't show my age, but yeah,
I used to get that one all the time. And when they said that in my head, I was like, we really doing this? Like, still, this is still a
yeah,
thing.
we're still
Like,
doing that.
it's crazy. So another thing I wanted to ask you about was I know you mentioned like cultural competence and humility and all other stuff, but and we talked about like the masculinity aspect of it. But do you have any specific, I don't know, ways that you think it would be easier for more black men to come into therapy? Like, what do you think we could be doing more? I feel like there's been way more media about it being okay. I feel like that's been a good thing. But do you think there's a way that we could kind of improve it a bit, like improve the amount of black men that feel supported in that environment?
Yeah, I mean, I think if we definitely part of that would be changing the pipeline and getting more black men involved in the profession as mental health providers. I think that would be sort of a one step to sort of address that. Because for those that may feel more comfortable working with another black male therapist, then that would sort of make them be more open to that experience. I think the other issue is that, just sometimes in how we um, implement therapy and treatment, that it can be very intimidating. And so I was reading something recently about just sort of the language that we use related to therapy. Oftentimes is sort of a turnoff, and I've come across this sort of work years ago when I first got into looking at sort of stigma around treatment for African Americans, but specifically to men. This idea about sort of therapy, it's like I don't go to therapy. I'm not doing that. So, what they talked about in this article was the idea of using sort of consultation or classes as a way to sort of bridge the gap and making
Hmm.
men feel more comfortable about treatment. And so, I think sort of the way that we overuse therapy language sometimes can be uncomfortable for people. And so, I like to make sure that for me, I try to one sort of reach someone on their level. So if they want to if they're interested in therapy and that's something that maybe they've had experiences before with therapy, they're more comfortable with it. But for those that may be not as comfortable, and also I know that they may have a specific interest. Like I work with a lot of kids, as I mentioned, and so boys tend to like playing sports, and so I'll use some of that terminology about consider myself as like a coach as opposed to being a therapist, and so I'm going to help you to sort of tackle whatever sort of challenges that you may be dealing with. And if it's anxiety or emotion, like we're going to practice these skills so that you can get better at it. So I think using language that is more acceptable to men and make them more comfortable within that process might be helpful to sort of address that particular barrier.
Yeah, I think that's a great idea, and I always try to use the same language that the patient uses, or I'll ask about their interests. I've even tried to like listen to music that the youth listen to, like my patients. But I've also seen like a big influx in, well, a big influx. There were none before, so everything's a big influx of men's groups actually
Yes.
that are being led by clinicians, and I really think like that's amazing. Like I wish I could find a way to include that more in like my practice. I think some of the stuff I'm limited to because I'm still in training, but I think that it seems like the fact that those groups have popped up so quickly and like they seem like they're packed shows that like there really is a need for individuals who want to work on things and feel that support.
Yeah. And that's a good point. And that was the other thing that the article noted was that sort of using more classes is also something that's helpful. Like group therapy might be more beneficial. And I think part of it is that making men feel like they're not alone in that experience, and so there are other people that might be sort of dealing with some of the same challenges and can talk about those things so they get more comfortable. And I think it goes back to this idea, like for people that have done support groups or done outreach in like barbershops, for example, like that's a very um, social sort of environment. And so by using groups, then it helps men to sort of have the barriers down more as opposed to sort of being one on one with the clinician.
Yeah, and I feel like it's great to meet people where they're at, like where they're more comfortable. And if you're already working with a population who may not want to see therapists in the first place, like why not do a barbershop thing? Why not do like, I don't know, some kind of group where they can socialize, because I feel like you get the actual aspect of therapy or consultation or whatever, but then you also get to find and meet some more Black men in the area. I always wonder how men like meet friends, because it just seems so hard for men to meet friends, whereas like a woman is like just way more simple. You just introduce yourself, well, for me at least, introduce yourself and you keep it moving. But I feel like the social support you get from like same-sex relationships is amazing, but I just think it's so much harder for men to do that.
Men tend to be more activity based, and so I do think like if you can do groups like that, then it might sort of foster that sort of uh, connection.
Yeah, and you know who else I recently heard about it by one of my committee members for my dissertation, and she was talking to me about there's this program. It's started by Omega Psi Phi fraternity. Actually, it's called Brother You're on My Mind, and the whole purpose is like education and training and collaborating with like Omega members and their families to communicate like the importance of seeking mental health. And to me, that's like a good way to meet people where they're at, right? Like you have a fraternity that's already plugged into the community. I think some things that are issues is when, you know, like you have someone who's not in the community and they're trying to help and they don't really get what's going on. So I think you really do need to work with people who are already plugged in to the community, right? Like the elders or the allies or the individuals who are already there. So they can tell you what they need. When I heard about this, I was just like, man, like this makes the most sense. You already got people who are like, oh no, these men aren't going to come to this. They're going to go to this. We do this event, you guys can talk about your spiel and we can kind of connect it. Like I think it's hard when you're doing like research or like trying to get more people integrated and you're just like, okay, well all the books say this work. And it's like, great. So in this community, we don't operate that way.
Yeah, that's a good point.
And it's kind of entitled. I think so too, because it's just like, well, okay, the books say that, but like we don't do that in like Philly or Houston or Baltimore. Like we don't know you. And we're not going to feel comfortable with the fact that we don't know you.
Yeah, and I think that's a big piece of like that cultural humility, because I feel like a lot of ways that we're trained oftentimes is not consistent with what might work with many communities.
Yeah, and I think that's because there's not as many of us. And well, actually, that's a good point. So there's not as many minorities or individuals from underserved communities in mental health. So what made you decide to get into mental health? Because like you're out here doing all of these things. Um, you've been doing it for a while. Like you mentioned like the media aspect of writing articles, the talk, doing talks and stuff like that. What made you decide to get into it? Like what appealed to you about it?
Yeah, so I don't know. I guess I'll say the interesting thing. I actually started majoring in microbiology when I was in college because I wanted to be a medical doctor. And then I took a psychology class in undergrad and learned more about it and then sort of became more interested in it. And as I got toward the end of my undergraduate career, started to learn more about just sort of mental health issues in communities and this idea about early intervention. And so for me, it was like, okay, we need more people in the field. We need to address sort of perceptions about treatment. And the best way to do that is to be able to sort of me be myself, get more involved in providing services and more about public education. So that's sort of been my focus.
That makes sense. I feel like yeah, I think I started kind of the same way. I was at my HBCU and I was doing bio because I think I wanted to be a nurse. And then the classes were so boring. So like maybe the classes weren't boring for you. But I was bored out of my freaking mind. I was like, oh my God, like biology and then biochem and stuff. And then psychology was like one of the few classes other than like Black history that wasn't boring to me. That's legit. And it's not even a special story. It's like it just didn't bore me. So I
Mhm.
stuck with it.
No, I still love biology and science, but
Oh no. See, that's enough for me, girl. I don't no. I left that like
but
I
definitely I fell in love with psychology.
yeah, and I like the fact that I like doing psychology, like having my undergrad at a HBCU. We learned like way different stuff. Like so when I went to PWI for my first master's, like the basic classes we didn't really have to do, but like the psych stuff we heard about were like Freud and Young and stuff like that. But at a HBCU, I heard about like Kenneth and Mamie Clark and like Dr. Jawanza Kunjufu. And like those were the first people that I heard about when it came to mental health, which made it appeal to me more. Um,
Hmm.
but then it's like limiting because then when you get the higher I got up, I was like, how come no one's talking about the Dow study or how come no one's talking about like things like that? And it's like those aren't the things that are really in the forefront because there are a lot of there have been Black people in psychology and combining it with social justice for forever. Like this.
Right.
So in talking about older clinicians such as like doctors Mamie and Phipps Clark and the Dow study, it kind of makes me think about how the field has changed as a whole. Like I know I talked a little bit about how there's more individuals like education in the media about mental health, but how would you say that the field has changed when it comes to psychology?
Yeah, I mean, I agree. I think that a big um, cultural aspect that has helped the change has been more psychologists getting involved in doing media work and being on social media. And so, because therapists are more visible to the public, I think that has also helped more people be more open to the idea of going to therapy, and specifically African Americans. And I think like with a lot of like celebrities, you know, having foundations and things like that talking about mental health, and athletes talking about mental health and going to therapy. So Dwayne Wade has recently talked about going to therapy after he retires. And so I think all of those things sort of help to shape how the public views being more open to using therapy.
Yeah, and I think it's great that I think it's a great that people are feeling okay about being so transparent about their mental health journey. I feel like two sides on it. Like one, I don't think anyone should have to be transparent about their mental health, like their journey to mental health well-being, because it's their personal journey. But I appreciate the fact that celebrities understand their power in that sense, and because
Right.
of that, they're trying to they're giving more of themselves just to say that like I'm doing this, and everyone lionizes celebrity. So I think it will be helpful if you can do it too. I think it gives a lot for people to connect to that aspect of it.
Right.
Like I don't think you should have to. I think there's plenty of stuff out there about how much therapy works and how amazing it is. But if Jay-Z wants to talk about how therapy helped his relationship, and if Dwayne Wade wants to talk about it, and Wale and everyone wants to talk about it, I'm not going to turn down nothing but my collar. But y'all can also
Right.
Google the
Well, yeah,
psychology.
but I think it also goes back to like just the cultural aspect of it, in that if people in our communities are not talking about it, then it's going to remain to be, a stigma around seeking help. And so I think in that sense, having more public figures be more open about it has been a big plus to maybe get more people in the community to start talk about that when they weren't in the past.
Yeah, I think it's a really smart move. And I think the way that it's not just celebrities, but the way it's been put on TV a lot is another thing. Like the way that, famous people will have depression, or like I was watching Blackish, it's an old episode, and Bo had postpartum depression. And even her, she's like, I'm a doctor, I would know. And then it comes out that she does have postpartum depression. Like not even just celebrities, it's put in TV shows and movies and all these things that just to make it that media always is a representation of the time, right?
Right.
So I like the fact that the inclusion of it is a representation of our time. Like hopefully it's understood that like within this time in the world, and we're becoming more cognizant of mental health and how it can be helpful to get help with that aspect of it.
Yep, I agree.
So, I mean, that's all I had for you today. One of the things I always ask is if you have like affirmation, a saying, or something that you could leave everyone with that could possibly help them when they're dealing with like crappy days, or something that could kind of drive them forward, something that may help you that you think can help others.
Well, so this might be a little bit cheesy, but I'm going to say so. My tag for my podcast is "You Set Your Mindset," and so I think really thinking about the way that you think about your day is going to either make or break it. So if you go into it with some positive vibes, you're probably going to do okay. But if you don't, it's going to probably not be as good as it could have been if you wouldn't have looked at it in sort of a positive way. And so I think you set your mindset is a great way to sort of go about your day, and sort of start out in a positive way.
Yeah, that is a good tagline. Do you have a book or anything like that that you absolutely love that you think anyone in this audience or in the world could benefit if they read it? Like, this is a great book. Everyone should read it.
Yeah, so I read a couple years ago this book by Michael Strahan, "Wake Up Happy," and it's like a motivational book, and I found it to be really helpful. I've actually read it a couple of times
Oh, that's
now.
how you know it's a good one.
Yeah, so and for me, like one of the things that I've talked about before with like thinking about sort of a podcast, for example, is that I think many of us are afraid or fearful about sort of stepping out into new opportunities. And so one of the things that book was really helpful for me was just sort of thinking about challenges that you might come across in your life, and sort of how to think about those challenges and be more positive and sort of set up specific goals and things like that. So it was really helpful for me to sort of think about sort of transitional periods, and it's I think it's a great book to sort of read more about.
Great. So that will be in the show notes. Also, I want you to tell everyone where they can find you. Like you mentioned your podcast, it's called The Breakdown with Dr. Earl, and it's just a mental health podcast on the mental health of Black boys and men. So if you are listening to this and you want to hear more from a Black male that is a clinician who is also plugged into what's going on right now, helping with coping with anxiety, depression, or just difficulties in the world that you take on as being a Black man, it's an amazing podcast to listen to. So tell them more about that and where they can find it. I pretty much feel like you can find it everywhere, though.
Yeah, so thanks for mentioning that. So there, you can look it up on Instagram at The Breakdown with Dr. Earl, and it should link you to be able to find it on my website. And there you can find it on SoundCloud as well as Apple iTunes. And then I'm also on Twitter and Instagram at Dr. Earl Turner, and also Facebook as well, Dr. Earl Turner. And be sure to follow me on those platforms and check out for information about mental health, as well as events that I may be having coming up related to discussions around mental health.
Yeah, and it's great because you've done a bunch of episodes so far. Like one was about coping with anxiety, another one was specifically about Black men in the mental health field. I know you had another one about like men and mindfulness and mental health, and even like religion and mental health use. So like you cover the gambit of multiple topics, but you're able to center it around Black males, which I think is something that's really necessary. Also, you write articles as well. Like you do research articles and journals and stuff like that, but you also publish pretty often in other dynamics. So can you talk more about that?
I do. So I have a blog on Psychology Today. It's called The Race to Good Health. And you can also find that from my website, which is drlangerturner.com. And it'll get you to all of my other outlets that I publish on as well.
And I feel like I'm pumping you up more than you are. You are forgetting stuff. Merch. You have merch too on your website.
I'm not good at promoting myself.
Oh my God.
So I do have some merchandise that recently started with my podcast. So I have mugs and shirts right now that basically promote mental health and well-being. So Black, Educated, and Mentally Well are both t-shirts, and you can find coffee mugs, and those are on my website as well.
Yes. Okay.
So thanks for that.
Did I forget anything about all of your stuff?
No, I think you covered it all. So if you go to my website, it'll get you anywhere you need to go. So from the blogs to the Facebook to the podcast, it's on my website.
Yes, and it's on your website, and you're also, the blogger on your website, but also U.S. News and Psych Today. Just to add that, just yes. Like, it's always so helpful to find people who are doing so much because you can be found so many different places. I want you to be found every single place. Just as like, oh, you missed the Psych News. Well, there was the U.S. News. There was a Psych Today. There's also a new podcast episode. And the best way to find you when it comes down to it, because I think the issue is that the information isn't out there. And when you find someone who is putting the information out there and they're a licensed and knowledgeable professional, you got to plug them. You got to put them in everything because
I appreciate that. And I think like one of the reasons that so I've been doing the blog. I started blogging about 8 years ago. And it's something that I've been, I try to do on a regular basis. But one of the reasons was because I feel like there's a lot of information out there on the internet that is not credible. And so I wanted to provide that information to the public so that they had that access to the information.
Yes, I feel the same way. I think the great thing about technology and everyone being able to access it is that information is everywhere. I think the worst thing about it is like information is everywhere and some stuff is not accurate. So when it comes down to having a licensed professional, I will always say, yeah, that's great on Dr. Google. But you know what else is great? Dr. Turner has something about this too. And he actually has multiple degrees. So let's cite that instead of having to go to Dr. Google about depression and anxiety and how it's not a thing. But once again, I really want to thank you for coming on the show. I really just love having more professionals. So there's more individuals talking about the different dynamics of mental health and hearing it from the perspective of a Black male who works with Black males and is doing so much. I appreciate you coming on the show. Everything that you mentioned in terms of your quote, your favorite book, and also where to find you will be in the show notes. And thank you so much for coming in, everyone. Mind Your Mental podcast can be found anywhere you like to find a podcast, iTunes, Spotify, all those good places. And just remember to be kind to yourself. Have a good day.